Okay, so I am studying for exam 3 for fundamentals. Let us do this. This is so cool. Okay. Hoping you're having a wonderful day. Okay. This season in my life has been a pretty interesting. Whew, girl. Okay. 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 Study. We're gonna look at. She gave us a blueprint. So I'm just gonna go check on dynamic quizzing to see what they have here. Talking about blood transfusion. Okay, so we're in fundamentals, so that makes sense to do that only. Okay. Okay, question number 1. A nurse is providing pre-operative teaching to a client who is scheduled for an arthroplasty in the next month and may require a blood transfusion. What the hell is an arthroplasty? Hold on one second. Arthroplasty. Is that arthroplasty? A surgical reconstruction or replacement of a joint. Okay, surgical replacement of a joint. Okay, an arthroplasty in the next month and may require a blood transfusion. The client expresses concern about the risk of acquiring an infection from the blood transfusion. Which of the following statements should the nurse share with the client? Which of the following statements should the nurse share with the client? Ask your provider to prescribe epoetin before the surgery. I don't even know what that means. You should ask your provider about taking iron supplements prior to surgery. I don't see why. Ask a family member to donate blood for you. Not necessarily. Donate autologous blood before the surgery. That's interesting. Epoetin before the surgery. But he is worried about a risk of acquiring an infection. So what can I say? I almost want to say D, but I don't know what autologous blood means. So hold on one second. Autologous blood? Hold on one second. Oh, see, that's what I thought it was. Okay, a blood that a person donates of their own use, usually for a blood transfusion during or after surgery. Okay, so I'm thinking that. Yes, okay, so it was that. So let's leave the explanation. Okay, so autologous blood transfusion is the collection and refusion of the client's blood. With preoperative autologous blood donation, the blood is drawn from the client 3 to 5 weeks before an elective surgical procedure and stored for transfusion at the time of surgery. Autologous blood is the safest form of blood transfusion because exclusive use of a client's own blood eliminates exposure to a transfusion-transmitted infection. That makes sense. Okay, so epoetin is a hematopoietic growth factor used for the treatment of anemia. While taking epoetin prior to surgery can boost the client's hematocrit levels, it is inappropriate if the client already has an adequate hematocrit level. Furthermore, this action might not eliminate the need for a blood transfusion and its related risk. While taking an iron supplement prior to surgery can boost the client's hemoglobin levels, it is appropriate if the client already has inappropriate, yes? recording. Yeah. If the client already has an adequate blood hemoglobin level and dietary intake of iron. A blood donation from a family member does not eliminate the risk of acquiring an infection. Okay, so that was Tino. So a nurse is leading an education session about disposing of biohazardous material. Which of the following instructions should the nurse include in the teaching? So use isopropyl alcohol to clean blood spills. I don't know. Discharge empty blood bags in a bedside trash can. Break used needles before discharging. Or place soil linen in a single linen bag. Already answered this, so it's place soiled linen in a single linen bag. So empty blood bags should be returned to the blood bank in case a transfusion reaction occurs and to reduce the risk of transmission of microorganisms. That's why. Chloride bleach should be used to clean blood spills to reduce the risk of transmissions or organisms. And to reduce the risk of injury, used needles should not be broken or bent. Water. Okay. A nurse is caring for a client who is receiving a blood transfusion. The client reports flank pain, and the nurse notes reddish-brown urine in the client's urinary catheter bag. So what do we have? Flank pain, reddish-brown urine in the urinary catheter bag, and the nurse recognizes these manifestations as which of the following types of transfusion reactions? So it's going to be what? A, hemolytic. Is it B, febrile? C, circulatory overload, or is it D, sepsis? Okay, so I already answered this, and it is hemolytic. So a hemolytic reaction occurs when the client's blood is incompatible with the donor's blood. Chills, low back pain, hypotension, and tachycardia are indications of a hemolytic transfusion reaction. Okay, let's read that again. Chills, low back pain or flank pain, right? Hypotension and tachycardia. So hypotension and tachycardia are indications of a hemolytic transfusion reaction. So hypotension and tachycardia. Okay, so a febrile reaction occurs when the client's blood is sensitive to the white blood cells, WBCs, and the platelets in the donor's blood. Fever, chills, headaches, and flushing are indication of a febrile reaction. I didn't know that. A febrile reaction occurs when the client's blood is sensitive to white blood cells. So like a fever reaction, white blood cells. Fever, chills, headaches, and flushing. Okay, circulatory overload occurs when the blood is administered too quickly for the client's circulatory system to handle. So dyspnea, not being able to breathe very well, coughing, headaches, and hypertension are indication of circulatory overload. Sepsis occurs when the blood is contaminated with bacteria. High fevers, vomiting, and diarrhea are indications of sepsis. Okay. A nurse on an oncology unit receives report at the beginning of her shift about 4 clients who are post-operative. Which of the following clients should the nurse see first? A client who is 1 day post-operative following a lumpectomy for small cell carcinoma and has a chest tube with 35 milliliters of an hour of bright red bloody drainage. A client who is 2 days post-operative following a colonectomy due to colorectal cancer and has an ostomy bag full of bright red bloody drainage. A client who's 2 days post-operative following the excision of abdominal mass and has a portable wound suction device with 20 milliliters an hour of seroanginous drainage. Okay. A client who's 1 day post-operative following the excision of bladder wall tumor and prostate and has a continuous bladder irrigation of 300 milliliters of an hour of reddish pink urine. First, it's got to be one of the first ones that are like day one. So I'm thinking it's A, because this is like their lungs, right? And we always want to like check with like their lungs. No, it's not. Is it this one? Oh my God. Is it B? Because it's full? Oh my God, bro. Okay. So a client who has 2 days post-operative following a colectomy due to colorectal cancer and has an ostomy bag full. Oh, ostomy bag. Okay, let me see that. Oh, wait, hold on. Let's see the explanation. Okay. The nurse should apply the unstable versus stable priority setting framework when caring for clients. Using this framework, unstable clients are prioritized due to the needs that threaten survival. The nurse should first address problems involving the airway, which is why I picked A in the first place, breathing or circulatory status that are life-threatening. Clients whose vital signs or laboratory values indicating a risk of becoming unstable are also the higher priority than clients who are stable. The nurse may need to use nursing knowledge to determine which option describes the most unstable client. An ostomy bag full of blood indicates that the client's bowel is hemorrhaging, and the nurse must report this finding to the surgeon immediately. The client may require fluid replacement, transfusion, and additional surgery to repair the bleeding vessel. This finding poses an immediate threat to the client's circulation. So incorrect option. Following a lumbotomy, the client may need chest tubes for both pneumothorax and hemothorax, collapse of the lung with blood in the pleural space. Fully reinflating and removing the remaining blood can take several days or more, depending on the severity of the trauma. Chest tube drainage of 35 milliliters is within the expected parameters of an adult client, especially on their first post-operative day. A client who has a drainage tube after a lumbotomy is stable. Okay, so a portable suction device drains a surgical wound by gently continuous self-suction. Over time, the drainage will change from sanguineous to seroanguinous to serous. Like it goes from like bloody, like really bloody water to like watery bloody, and then like just watery, if that makes sense. So seroanguinous drainage of 20 milliliter an hour on the second post-operative day is within the expected reference range for an adult client. Okay, so this again is stable, right? Continuous bladder irrigation, CBI, prevents clots from forming in the bladder. To keep the client's urine free of clots and mucus plugs, the nurse should irrigate the bladder with 0.9% sodium chloride. During the first few post-operative days, reddish pink urine at an hourly output slightly greater than the amount of solution the nurse instills is expected. Consequently, drainage of 300 milliliters an hour on the first post-operative day is within the expected reference range for this client. Damn, okay. That got me fucked up. Okay. So a nurse is explaining the use of written consent forms to a newly licensed nurse. The nurse should ensure that a written consent form has been signed by which of the following clients? The nurse should ensure that a written consent form has been signed by which of the following clients? A client who has a prescription for a transfusion of packed red blood cells. A client who's being transported for a radiography of the kidneys, uterus, and bladder. A client who has a prescription for a tuberculin skin test. And a client who has a distended bladder and needs urinary catheterization. I would believe it is for the transfusion because we're on this. Yeah. Okay. Okay. So why? So administration of blood is a procedure that carries risk. Therefore, the client must sign a consent form prior to the procedure. So the other one that I was thinking about picking was like D for like the catheter, I think. So implied consent is implied. Okay, so it says implied consent is given when the client cooperates through actions, such as positioning himself or herself to allow the nurse to perform this procedure. And that was for the catheter. Implied consent is given when the client cooperates through actions such as holding out an arm to allow the nurse to perform the procedure. Okay. Tuberculin skin test. Oh, okay. All right. So let's go back then. Oh, you know what we should do is also flag these. Or like, what is it called? Mark these? Mark. 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 Okay. Grade. It's all good because oh god. Okay. How do we go back? No, not that way. Oh, no. Not that. Oh. Ah! What did I touch? Okay. So let's go and check. The next thing on the blueprint that she had picked was interventions for hypernatremia and hypokalemia. So let's... She was specific this time. Okay, the first one was hypernatremia. Natremia. He doesn't even know what the hell that is. Hypernatremia. Okay. Okay, hypernatremia. Is there 4? There's only one question about hypernatremia. Fundamentals 1. I mean, I guess we can just do the one question then, I guess. But I would do medical surgical. Yeah, whatever. Do all of them. Let's see. A nurse is reviewing the laboratory findings of a client who has chronic kidney disease. The client reports significant persistent nausea and muscle weakness. Which of the following findings should the nurse expect? I mean, we're talking about hypernatremia, so I'm thinking all these answers are going to be hypernatremia now. So what are we talking about? Significant persistent nausea? It gives them nausea? And muscle weakness? I guess. Let's see. No? The client reports significant persistent nausea and muscle weakness. Muscle weakness would be... and nausea? Is it hypomagnesemia? That better not be. Hyperkalemia? Oh my god. So a client who has chronic kidney disease can have hyperkalemia, which is a potassium level greater than 5.0. The expected reference range for potassium is 3.5 to 5.0. Other manifestations of hyperkalemia can include palpitations, dysrhythmias, nausea, and muscle weakness. So hypernatremia is indicated by a sodium level that's greater than 145. The expected range that they're giving us is 136 to 145, but I remember 135 to 145. So manifestations of hypernatremia include dry mucous membranes, agitation, thirst, hyperreflexia, and convulsions. It is not associated with chronic kidney disease. Okay. Hypomagnesemia is indicated by a magnesium level below 1.3. So I think, yeah, 1.3. The expected reference range for magnesium is, I want to say 1.5 to 2.5 because it's like easier, but I guess 1.3 to 2.1. Hypomagnesemia, I said it right, correct for the first time, is present in clients who have hyperthyroidism or diabetes. Hypomagnesemia is present in clients who have hyperthyroidism, or diabetes. If you think about hyperthyroidism, it's like they're like on the go, right? Hypothyroidism is like slow and low. Hyperthyroidism, they're fucking like on it. And hypomagnesium, so magnesium like relaxes the muscle. Okay, so if it's hypomagnesium, everything is like quick and fast, I guess, not chill, right? So hypothyroidism or diabetes, or clients who are pregnant. Also, hypomagnesium is like found with people that are like alcoholics. It is not associated with chronic kidney disease. So hypercalcemia is indicated by a calcium level greater than 10.5. So it's 8.5 to 10.5. So, okay, it's telling me something different here. The expected reference range for calcium is 9.0 to 10.5. So hypercalcemia is present with some cancers, but it is not associated with chronic kidney disease. I did not know that. Okay. So a nurse is providing dietary teaching a client who has late-stage chronic kidney disease. Which of the following nutrients should the nurse instruct the client to increase in their diet? Should? I would say calcium. Okay, yeah, because then remember they were just talking about how there was going to be like high potassium levels, and what happens is that, I think it, hold on, let's see the explanation. So a client who has CKD can develop hypocalcemia due to the reduction of active vitamin D, which is needed for calcium absorption. The client should supplement dietary calcium. Okay, so I did not know that. CKD can develop hypocalcemia due to the reduced production of active vitamin D. So a client who has CKD can develop hyperphosphatemia because excretion of phosphorus by the kidney is reduced. A client who has CKD can develop hyperkalemia because excretion of potassium by the kidneys is reduced. And a client who has CKD can develop hypernatremia because excretion of sodium by the kidney is reduced. To increase in their diet. So phosphorus, potassium, and sodium will naturally go up, but calcium not so much. So a nurse is reviewing the laboratory data of a client who has a fever and watery diarrhea. Which of the following results should the nurse report to the provider? Calcium is in a good range. Sodium is a high range, 135 to 145. Potassium is from 3.5 to 5. Magnesium is, I don't know. Is it magnesium? I forgot what the fucking range was, to be honest. But sodium is not right. Yeah. Okay, sodium level of 150 is greater than the expected range of 135 to 145. This client is at risk for dehydration due to diarrhea. Hypernatremia is a manifestation of dehydration. and the nurse should report this finding to the provider. Okay, magnesium. Okay, a magnesium level of 1.5 is within the expected reference range from, oh, see, we were just talking about magnesium. It's 1.3 to 2.1 or 1.5 to 2.5. Okay. This was a good one. Mark. What is this one on? Is this for? It's a good question. I mean, all of them were pretty. They were good questions. Okay, can we go to the question list now? No, not that question list. Shoot. Grade. Okay. Oh my god, 100%. Cool. Oh, the fundamental one was the middle one. What was the middle one again? Okay. Okay, reset question bank. What the fuck? How do I go back? Hi. Okay. Back to my quizzes. Jeez. Okay, new custom quiz. Let's go to study. And let's figure out what's the next one? Hypokalemia. Hypokalemia. There's 4 questions on it. Okay, clear and just do fundamentals. Okay. So a nurse is reviewing the laboratory values of a client who has a positive Chbosky sign. Which of the following laboratory findings should the nurse expect? So this is what happens when what? This is tetany, a form of tetany, because why? Because there is a decreased level of what? A decreased level of calcium. Okay. Yeah. Okay. So calcium is necessary for nerve conduction and muscle contractions. When the client's total calcium level is lower than 8.4 milligrams per deciliter, tetany and muscle spasms may occur. So the nurse should tap the facial nerve in front of the client's ear or the masseter muscle for, cranial nerve number 7. If facial muscle twitching follows this stimulus, it is a positive Chbosky sign, an indication of hypocalcemia. Hyperkalemia occurs when the client's potassium level is above 5.0. The nurse should assess the client for muscle weakness, cardiac dysrhythmias, and other clinical manifestations of hyperkalemia, but not a positive sign of Chbosky sign. Have you noticed that it says muscle weakness for hyperkalemia? So hypercalcemia occurs when the client's total calcium level is lower than 10.5. Because hypercalcemia. So the total calcium level is lower than 10.5, which is weird because didn't they say it was like 8? Okay, so didn't they say on this it's a 9 to 10.5? So why is it the total calcium level is lower than 10.5? The nurse should assess the client for lethargy, weakness, and other clinical manifestation of hypercalcemia. Oh shit, that's more than, oh girl. Okay, more than 10.5. That's hypercalcemia. So the nurse should assess the client for lethargy, weakness, and other medical manifestations of hypercalcemia, not a positive Chbosky sign. Muscle weakness with hypercalcemia. Hypocalcemia, it's muscle weakness as well. Oh wait. hold on. That's hypokalemia. Calcium, that's okay. So lower than 8.4 for decreased calcium, the nurse should tap, okay. Tetany and muscle spasms may occur. So there's spasm in calcium, hypocalcemia, and hypercalcemia is muscle weakness. Oh my gosh, I'm getting myself fucking confused. Okay, so a client reports a 4-day history of abdominal cramping and diarrhea of 4 to 6 liquid stools a day. That sounds gross. Well, I mean, they're dehydrated, right? So client reports taking by mouth cephalexin for an infection. What is that? Antibiotics were completed 7 days ago. Abdomen soft, non-distended with hyperactive bowel sounds and audible. Neck veins are flat. Capillary refill is slow. Stool contains mucus and foul smelling. Stool sent for culture. Okay, so potassium is low, 3.0. Hematocrit is 55%, which is a little bit above. Urine specific gravity is 0.042. That's high. So he's dehydrated. Stool culture positive for C. diff. So we are not restricting the client's fluid intake. Obtain a prescription for an osmotic why would we do that? Laxative. Place the client on contact precautions for C. diff? C. diff. Contact precautions. I think so. Use an alcohol-based sanitizer. No, we don't use alcohol. We need to use like the purple wipes. I forgot what it's called. It starts with a C. Monitor the client's heart rhythm. I would, because his potassium level's fucked up. Obtain a prescription for potassium. Why would we? It's low, right? Yeah, so I guess we could do that. Let's see. I don't know what's right or what's wrong. Oh, it's correct. Okay. Shit, I cannot read. Therefore, the nurse... Why? Okay. When generating solutions, the nurse should plan to place the client who has C. diff on contact precautions to reduce the risk of transmission of the infection. The nurse should plan to administer a potassium supplement to the client who has a potassium level that is less than the expected reference range. Hypokalemia is an adverse effect of diarrhea. Oh, okay. Hypokalemia is an adverse effect for diarrhea and places the client at risk for dysrhythmias. Therefore, the nurse should plan. Okay, so hypokalemia is an adverse effect of the diarrhea? I did not know. Why is it so hard to like show this? Okay, weird. Okay. So a nurse is reviewing the laboratory data of a client who has a fever and watery diarrhea. Which of the following results should the nurse report to the provider? Sodium is high. Didn't we just take this one? He's dehydrated. Okay, so a sodium level of 150 is greater than the expected reference range of 135 to 145. So this client is at risk for dehydration due to diarrhea. Hypernatremia is a manifestation of dehydration, and a nurse should report this finding to the provider. Okay. Magnesium level is 1.2 to 3.1, right? Or is it 1.3? Oh my god, it's 1.3. 1.3. See, this is why it should be 1.5 to 2.5, because this stupid shit is making me fucking confused. Okay, 1.5 to 2.5. Fuck it. I can't even get the explanation. Is it? Okay, that was the explanation. Oh, so, okay, a nurse is monitoring a client's laboratory results. Which of the following results should the nurse report to the provider? Sodium is a good range. Potassium is a low range. Chloride? I don't even know. The magnesium is 1.5 to 2.5. That's fine. So it's potassium. Okay. No, chloride was 97 to 107, right? Or something like that. Okay. Okay, right? Right. So the potassium level is below the expected reference range, indicating hypokalemia. The nurse should report this finding to the provider for instructions about preventing muscle weakness. So this was a good one. Let's go over them. So a nurse is reviewing the laboratory results. Okay, we already know that. That we don't have to go over. This I wanted to read more about, but I can't. So let's just read what it can right here. So when generating solutions, the nurse should plan to play. Okay, so hypokalemia is an adverse effect of diarrhea. So if you have diarrhea, not only are you dehydrated, let's look at the labs on this. Oh, was there labs? What the hell? Anyway, can't even get the labs. Okay, that's high and that's low. Okay. Okay, we should just put this and mark it. Okay. Let's just go all the way back again because I don't know how this even works. Okay. Let's study and let's put, what's the next one to look up? Signs and symptoms of hypervolemia. Hypervolemia. There's only one question. Maybe just do all three. Or all of them. Fuck it. I'm thirsty. Okay. So a nurse is assessing a client who has fluid volume overload from a cardiovascular disorder. Which of the following manifestations should the nurse expect? He has fluid overload, so JVD, moist crackles, postural hypotension, no. Increased heart rate, maybe, because like it's working hard, but it doesn't. I don't know. I guess it is. Let's see. So jugular vein distension, hi. Moist crackles and increased heart rate. So the increased venous pressure due to excessive circulating blood volume results in neck vein distension. Moist crackles are indicators of pulmonary edema that can quickly lead to death. And fluid volume excess or hypervolemia is an expansion of fluid volume in the extracellular fluid compartment, which results in an increased heart rate and bounding pulses. Okay. I mean, that was a good question. Okay. A nurse is planning care for a client who has a syndrome of inappropriate antidiuretic hormone with mild manifestations. The nurse should expect the provider to prescribe which of the following medications? Vasopressin. Why? Oh, because it already has antidiuretic. There's too much antidiuretic. They wouldn't. Desmopressin? No? I don't know any of this. So it's tolvaptan? Okay, SIADH is a disorder of water intoxication due to the inappropriate continuous secretion of antidiuretic hormone by the posterior pituitary gland, causing hypervolemia and hyponatremia. Okay. Treatments of SIADH include fluid restriction, sodium replacement with small amounts of 0.9 sodium chloride, and a vasopressin antagonist such as tolvaptan, which promotes the excretion of water, which helps correct the fluid imbalance in clients. Okay. All right, so a nurse is caring for a client with dehydration who has developed hypovolemic shock. Which of the following laboratory values should the nurse expect for this client? For hypovolemic shock? Hypovolemia. I would think it's urine specific gravity that's like really, really low. But B1 at 18, I think it can go up to 20. The only one that hematocrit? The hematocrit to 55. Oh, it's elevated. Okay, so an elevated hematocrit indicates hypovolemia. Other indications of hypovolemia are weak pulse, tachycardia, hypotension, tachypnea, slow capillary refills, elevated B1, increase urine specific gravity, and decrease urine output. What is the levels of the hematocrit in the first place? I don't even know. That's an increased hematocrit? Fuck, I don't know. Alexa, what is a normal hematocrit level?
Here's something I found on reference.com. Medline Plus states that a normal hematocrit level typically ranges from 40.7 to 50.3% in men and 36.1 to 44.3% in women.
Like
In
36
children,
to
a normal
44
hematocrit
or something like that?
ranges from 45 to 61% in newborns
Oh.
and 32 to 42% in infants. Wikipedia explains that the hematocrit is the percentage of whole blood that is made up of red blood cells.
Percentage of whole blood. Red blood cells.
It is often included in a complete blood count test. A low hematocrit could be due to anemia, blood loss, malnutrition, or overhydration, while a high hematocrit could be caused by congenital heart disease, low blood oxygen levels, or dehydration.
Okay. She might have to say that again. A nurse is teaching a client who has chronic kidney disease. Which of the following instructions should the nurse include? Limit fluid intake. Limit calorie intake. Eat a diet high in phosphorus. Eat a diet high in protein. So it would probably be limit fluid intake because you can't it can't. So a client who has CKD should limit fluid intake to prevent hypervolemia. A client who has CKD should increase caloric intake so the body can use protein for protein synthesis instead of energy consumption. A client who has CKD should limit phosphorus intake because the kidneys are unable to excrete it. A client who has CKD should not eat excessive protein to prevent the buildup of protein waste products and uremia. Well, that makes sense. The limit fluid intake. Hematocrit levels of. I've never heard of this, but I'll go and mark it anyway. This was a good one. Can I get going now? Grade. Oh my god, I got all of them cracked. Can I go back? I can't go back. Question list. Close. Back to results. Okay. Oh my god, for freaking reals, man. How do I get back? Most of the time it's just me trying to get back. Yes. Hypervolemia. Clients most likely to have high K, low Na, low Ca, and low magnesium. Okay. Oh my gosh, excuse me. Fluid and electrolytes. What? Fuck it. A nurse is assessing a client who is receiving continuous ambulatory periodontal dialysis. What? Peritoneal dialysis. Which of the following findings should the nurse report to the provider? Report? Okay. Probably like a low potassium level. Yeah. A potassium level of 3.0 is below the expected reference range and can cause dysrhythmias. Dialysis removes fluid, waste products, and electrolytes from the blood and can cause hypokalemia. I did not know that. Okay, so a white blood cell count of 6,000 is within the expected range. Don't tell me what the actual white blood cell count is for me. I have no idea. Okay, so the nurse is reviewing the client's electronic medical record. For each of the client's findings, click to specify the finding is an improvement or not an improvement of the client's condition. There must be at least one selection in every row. Okay, electrolytes findings. How am I supposed to know? I can't read the... I don't know what this was. Okay, a nurse is assessing a client who has increased intracranial pressure and has received intravenous mannitol. Which of the following indication indicates a therapeutic effect of this medication? I would say bronchial spasms, but okay, a nurse, intracranial pressure. Wouldn't it just be increased urine output? Yeah. So mannitol is an osmotic diuretic used to reduce intracranial pressure by mobilizing intracranial fluid and inhibiting the reabsorption of water and electrolytes in the kidneys. Increased urine output and decreased intracranial pressure are therapeutical effects for this. Okay. So a nurse is caring for a client with Addison's disease who has admitted with muscle weakness, dehydration, and nausea and vomiting for the past 2 days. Which of the following prescribed medications should the nurse plan to administer? So Addison disease is a like anti-diuretic like problem, I think, or something. What was it again? Rivampin is like for tuberculosis. Mide? I don't know about the mide. Hydrocortisone. Is that like low? I'm thinking it's hydrocortisone. It is. So the nurse should identify that a client who has Addison's disease will require hydrocortisone to assist with replacing cortisol levels. That's what it is. A client who has Addison's disease has adrenal corticoid insufficiency, which is the inability of the pituitary to produce cortisol. Illness and stress can require steroids like hydrocortisone to restore hormone levels. Lupramide is an anti-diarrhea. Spironolactone. Okay. Good to know. A nurse is providing teaching about sodium phosphate to a client who has a new prescription for sodium phosphate. The client is scheduled for a colonoscopy and is currently taking furosemide for hypertension. Which of the following client statements should indicate to the nurse that the teaching has been effective? I would think it's B. I don't know about I can take my water pill as prescribed, because why would you need that? I should drink 8 ounces of bowel cleanser. I don't know why. I can experience rebound constipation when using this medication. I think it's B. That's the only thing that makes sense to me. Okay, so sodium phosphate can cause excess fluid loss as a result of cleaning the bowel of the stool. Therefore, the client is at risk for electrolyte imbalance and should be monitored closely. Okay. I am fucking done for now. Let me see. Hold on. How do I get back to like everything? Ah! I think that's a sign. We'll just wait for a little.